I'm Dr. Nick Hoyer. I've been here for 5 years. I'm one of the chiropractors in the practice, but I also fill the role of being the head chiropractor when it comes to both decompression and also being kind of a liaison in between the medical side and the chiropractic side of things, working with the nurse practitioners and the MD. For spinal decompression, it's going to be for addressing any kind of a degenerated disc or a herniated disc. If we have a patient come in that because of mechanical issues in their spine that the condition of the spine has deteriorated, then this is a way that we can address that deterioration and try to improve upon the condition of it. Anyone that we see come in with, anywhere in the phases of degenerative disc disease, which first it will start out as a loss in the height of the disc. So anyone that has that, which it can be someone that also has a disc herniation, maybe has pressure on a nerve root that goes down into the leg or down into the arms. It's a way that we can relieve that pressure on it and decrease those symptoms. It can manifest just as low back pain itself. It could, or neck pain. It could be radiating pain into, again, the arms or the legs, usually in what they call a radicular pattern, so it will go in a particular pattern through the leg or through the arm. Sometimes we simply recommend the therapy just based on the fact that their disc is in very, very poor condition. They may not have any radiating symptoms. They may not even have neck or low back pain, but because of the condition of their spine, it's a recipe for disaster. So we're just trying to mitigate those damages and create a better future for them. But as far as success stories, I mean, we've had patients come in with, they can barely get on and off the table, and within a course of a few visits, get them walking again and walking comfortably. Or say, we've even had patients come in that they know they're going on vacation in 2 weeks, and they just want to get to the point where they can have a good time with their loved ones and just get out on the beach or get on the ski slopes, whatever they want to do, and we get them to a point that they're able to do that. And I would say, people that come in with, even the most severe of symptoms, it's at least an 85% success rate that we see with those, that there's a significant decrease in their symptoms within a relatively brief amount of time. When it comes to lumbar decompression, so we would be dealing with the lower part of the spine in between where the ribs end and where the pelvis begins. There's a strap that goes around the hips and then around the base of the ribs, and then the lower part of the table that's attached to that lower strap just moves away from the upper part. It does it in a very gradual and controlled sense. There's actually sensors in the table that sense how much tension there is in the system. So it's never going to pull too much, it's never going to pull too little, it's going to pull at the right amount based on how much the patient is resisting it. But by applying that tension, then we're opening up that disc space with the idea of trying to get fluid back into it, or in the case of a herniation, reduce that down so that you have a thicker disc that creates more room for the nerve to exit the spine, or just create more room for the nerve by getting that bulge to kind of come back into where it should be. For the first 5 visits of the treatment time will increase progressively over those. Usually say they're on for lumbar decompression. They would be on the table for anywhere from 12 to 15 minutes for the first visit, and then it will increase 3 to 4 minutes each visit over the first 5, and then usually they'll be in between 25 and 30 minutes for their treatment time. Once it hits that point, their maximum point, then it stays at that for the rest of their care. Basically, with chiropractic care, we're correcting the mechanics of the spine that, with abnormal biomechanics, is causing the spine to deteriorate. So with the chiropractic care, we can stop things where it's at, but with the decompression therapy, we can actually improve upon the condition of the spine. We're actually looking at, increasing those disc spaces, and again, trying to create more room for the nerves to exit the spine. On the medical side of things, it's a really similar situation, that on the medical side, we're looking at palliation of symptoms and trying to decrease those pain signals going into the brain. And I'm saying this in kind of generalities. There are different things that the medical side can do too, depending on what type of intervention it is. But with doing the decompression therapy, it's a non-invasive way of trying to improve the condition of the spine and let the nerves do what they're supposed to do. Whenever we're treating a disc issue, be it a herniation or a degenerated disc, it's going to be a 20-visit regime of care. Ideally, within the first 2 weeks, you're going to be seen 5 times a week, so basically daily of the days that we're open during the week on that table for the first 2 weeks. And then it goes down to 3 times a week for 2 weeks and then twice a week for 2 weeks. Sometimes patients aren't able to maintain that schedule for especially the first 2 weeks when it's daily. So if we do 3 times a week, then it's for the first 5 weeks, and then we transition down to twice a week. After that, there is a maintenance regime that it is the patient's choice whether they choose to do that or not, regardless of, kind of their outcome that they've had to that point. But in the case of transitioning into more so maintenance, you go down to every other week, once every 3 weeks, and then you're out to once a month, and that's where you maintain everything at. For the first, as far as negative side effects, let's go into that first. Negative side effects that someone can experience, and again, mostly it's going to be after lumbar decompression. Cervical decompression, since you're dealing with a, I guess not delicate, but a less robust and like lots of thick tissue like what you are down in the lower back. Up in the neck, there's not so much of that. So the table will pull to a lesser extent. It's less of an aggressive therapy than what lumbar decompression is. So if someone, say, if they're more acute or not really acute at all, when you take gravity out of the equation and stretch the spine, sometimes when you come out of that, then the body can kind of rebound and the muscles will go into a spasm to try and protect it. So the things that we do after the therapy are meant to combat that or minimize it at least as much as we can. So make sure that the patient stretches out before they get off of the table. Do that at least for a minute or two. And then they do wear a low back brace for the first half hour after the treatment. They can wear it for as much as 3 hours, but at least for the first half hour so that we kind of transition back into being in an upright posture and having to deal with gravity again. We have had patients as young as 16 years old be on the decompression table, again, depending on what their body has been through. Usually at that age, they're more apt to have some type of a disc herniation, which is still, more so a chronic condition is what it's viewed as today. But, it could be anywhere up to 85, 95 years old, which usually at that point, it's more so that the disc is degenerated at that point. From the get-go, it's just a matter of giving the patient the knowledge that they need to understand what they're going to undergo. And with the way that our therapy area is set up, it's just as simple as taking them back there and letting them see someone on the table. And a lot of times, a patient that is actively under that care can be the one that sets those, kind of concerns at ease.